It is Charles Payne time. I was going to say
I'm
CP,
nervous.
but I think I would get in trouble if I said it's CP time. I'm sorry. Outnumbered overtime. OT, baby. It just hit me. Wow. Healthcare. Are we any brighter about what's coming down the pike?
I love the action on Twitter, right? I mean, people like, oh, man, I understood it fully, and I have a PhD. It's like,
no, that's what you're saying.
The American public is confused about all of this. They're frustrated about all of this, and there are a lot of people who are very angry about all of this. And you know what? You got to address all of these people. You just can't keep saying, hey, I'm going to go up there, roll up my sleeves and do a slideshow. I don't think the needle moved much.
If what Paul Ryan did was so effective, Donald Trump would not be president. Donald Trump speaks like the average person. People can understand what he's saying. It's very concise. It's not that I thought that it wasn't valuable that he did that, but it is too valuable to a very specific audience. And as you said, there are a lot of people who are confused about what's going on with the Freedom Caucus, Medicaid expansion, if this is really going to be the promise that so many voters wanted during the election cycle and voted for. So it's not that I hope not. I love Paul Ryan. I'm not trying to be disrespectful to him at all, but I agree with you that I don't know how much that actually moved the needle.
There's a lot of technical stuff in there. There really is, and unfortunately, it
the
needs
piggy
to
bank
be
didn't help though with the coin. That didn't help.
Who's doing the health savings
Well, I mean,
account?
I think people get hung up on the term reconciliation because it means something very, very specific.
What do you think oh my gosh, I'm so glad you said that. So what do you think he being the speaker means by reconciliation? Because in my book, it's like you and I like fight over the cute purse that's on sale, and then we reconcile, and you can have the wallet, and I'll use the bag on Sundays.
I know you.
But
always get the bag.
Oh no, not always. Sometimes you get the shoes.
You deserve the
My
bag.
point is that what he means? Are we going to have a situation where it's truly compromise, or is that word used differently?
I think it's used differently in a legislative context, and I think that's what is so off-putting is this technical language has a very, very narrow definition.
But it's a civics lesson. So if people don't get it, either people give I'm not going to curse. Either the American people give enough to learn about it, or they will just follow dumbly and blindly into the night.
I think the
I think
latter
we were read dumbly and blindly into the night with Obamacare, and people are so wounded by that.
Yes.
Let me just say this. People in this country have been conned into thinking that they pay for Medicare.
Yes.
Medicare is single-payer insurance that we're paying for, not the people on it. That's why it's going broke in 11 years.
Every entitlement is a Ponzi scheme.
Oh, that's interesting.
Social Security included.
You need that on a T-shirt. Every entitlement is a Ponzi scheme.
Yeah. Stop. But I'm talking to my parents. Stop telling me that you paid for this because you didn't.
Let me tell you something.
Sure feels like it.
We all give speaking, speeches at different places. You just gave one to the FBI, which that's the coolest thing I've ever heard.
Cool.
Coolest thing I've ever heard. For me, when I'm making a presentation, I make sure that you can come into the room and you can be someone who has never picked up anything on politics ever, don't understand it at all, and I'm going to explain to you my beliefs, why I believe them, and why you should believe what I believe. That's my responsibility as a speaker who is hired. I think I do agree that more people should be doing more research. I wish a lot of people did a lot more research about a lot of things during the election. I wish people would do a lot more research about what exactly WikiLeaks and what exactly they're doing and their ties to Russia, and why I think they're trying to make us feel less safe and less respectful and trustworthy of our institutions in general. So I think the onus has to also be on the messenger as well. So I'm not mad at Paul Ryan, but I'm still sticking by my guns that this was not 100% a home run in expanding the audience that I think he was intending to.
So I think Paul Ryan's job is different than President Trump's. And not just because he's in the White House, but because he is a superior communicator. Nobody is going to confuse Paul Ryan with Barack Obama or Donald Trump in terms of their ability to get a message across. And yes, we had many Barack Obama lectures when he was president, but he was a very gifted orator.
Sure.
So no one's going to confuse Paul Ryan with being either of those people. His job, as I understood it, was to go out there and contemporaneously try to hit some of the issues that people are expressing on Twitter and other places, along with folding in, this is why I think this is the best plan version of 1, 2, 3, or 4, or whatever. I want to get this in. Rufus Sulphur says that he's now the person to ask Harris Faulkner this question. I'm like, oh gosh, what's it going to be? So here's the question I have not heard anybody address, Harris. How many of the Republicans opposing this healthcare bill, God bless you,
Excuse
me,
are
sorry.
not up for re-election in 2018. This would be interesting start. And how many are in districts which voted for Trump? Aha, very interesting question.
That only applies to the Senate because everyone in the House is up in 2018.
Yeah.
The House.
Yeah.
Speaking of
Mark
civics,
Sanford.
they get reelected every 2
Will
years.
they keep their mouths closed is the question.
Freedom Caucus people know. I mean, I think
No,
when you have people
they've-
like
they've spoken
Mark
up
Any
for
of
it.
them
yeah.
in jeopardy,
Yeah.
I guess.
They
is
were
the
they were
question,
ready
too.
to
Thank you
speak
for
up.
that
They
question.
were looking for it, and they, it's like there's a big difference between full repeal and full replace. And what Paul Ryan is having to explain is if we try and go through that process, if we try from the foundation to build something all the way up, we are going to get so much pushback that it will be impossible. It will die in the Senate, and that's the point of reconciliation. You can modify things, but you cannot
Did
completely
you hear him say
change
that
them.
as clearly as you just did?
He did. He said it was going to die in the Senate if they tried to do that, but he was talking specifically about selling insurance
Yes.
across state lines
right.
and some of the stuff that you cannot do in a reconciliation.
You
Because
need
here's what
60
Rand
votes.
Paul said.
I
But
just
here's
want
To
what,
overcome
here's
a
what-
Senate filibuster.
The Democrats already won. Theoretically,
Yes.
the Democrats have already won this.
Yes.
Because we're not going back to square one.
You're
we're
absolutely
not
right.
going back to scratch. We're not going back to pre-2009.
It's now considered
It's
a
now-
right.
It is
Well, how many governmental
It's a cultural
programs
shift.
have
Yeah,
you
you're
ever
absolutely right.
seen quashed and turned around?
There's been
it's a
one.
giant
Yeah, so why would it be the
entitlement.
biggest one right
It is
now?
a
It wouldn't
big-
be.
It is a big. It is a big
Yes.
government handout to people to buy health
And
insurance.
it's been here too long.
period.
Yeah. So
Look
the
at
last
Medicaid.
one
one
was
thing-
George H.W. Bush in 1989, and I know I'm going to get the description of the program wrong, but let's say that it extended Social Security into real estate, and that's the best way I can grasp it. And because it passed, it was unpopular, they were able to repeal it in short order. This bill has been around for too long,
right.
and now people are used to the idea.
I want to get in
of healthcare
Mr.
rights.
007, Mr. Bond.
Please do.
Yeah, don't we all? Except for Charles, maybe. He already
Well, I
thinks
like
he's
his
James
gadgets,
Bond.
though.
Charles is James Bond. Don't repeal Obamacare. Let it fail. Roll out a new system and let it run side by side. If the new system will be good, people will abandon Obamacare and it will evaporate. Your
Can't afford it.
thoughts?
No.
Oh, God.
Talk
I
to
mean, we
people
are
in
talking
Arizona.
about, human
the
beings
premiums
here.
are over 100%. I keep
Can't afford it.
116% in
technically,
Arizona. That's
health
right.
insurers, hospitals, and doctors couldn't
Okay.
operate
Yeah.
in
This-
a
in two
parallel
systems.
universe.
The Republicans were elected to fix this, not to
Yep.
let it die on the vine.
That's like
Can I-
healthcare
Why didn't they
bigamy.
already have plans together over
They had
the
a
last
lot of
6 or
plans.
7? Why couldn't they have gotten together
Price
like at somebody's
did.
house? Right? Because
They had a lot of plans.
You heard Speaker Ryan say, we ran on this in 2010, 2012, 2014, 2016. That means most of those people were still around at that time. Why didn't they get together at like Bob's house and come up with something?
I don't know. Some people have the theory that sometimes the
Bureaucracy.
dog actually catches the car and then doesn't know what to do. It's like,
Okay,
No,
Joe
exactly
DeWine
right.
says on the live
That's a
chat, we
great
want to thank
analogy.
everybody for joining us because I think we've hit a record number on the live chat today. Joe DeWine, this is going to be for you, Charles. Medicare is going broke in part because U.S. corporations have exported so much of the tax base. Go.
Oh, shut up.
Good Lord.
Gosh, you don't sound like Charles.
Ridiculous. Medicare's
He didn't
going
say
broke
anything.
because the benefits are too generous, and the federal government will never say no to an elderly person.
Do you
They
want elderly
paid in
people
too
vote.
little money over the years, and people aren't having enough babies.
not
you know
unlike
what-
Social Security, which
Yeah.
both of them were designed
Are
to
you
flawed so
saying that we
badly
should get some of the elderly to have
inception.
babies?
No, but the young
Do you know
people
what?
we need to be growing the population
No, because
base and then cutting the
just
dead on
like in
benefits.
Japan and Italy, we're facing a population crisis because we are essentially depopulating. We are not having as many children as we were, and you've got more people, whether it's on
It's getting
Medicare or
worse,
Social
too, by the
Security,
way.
who are retiring, who are going to have greater health care needs, and you don't have. That's where the individual mandate came from. It was the government holding a gun to young people's
Can I
heads,
give you a
forcing them
stat?
to buy insurance.
All right,
to
I
pay
really
for
wanna-
older
Can I
sick
give you a
people.
quick stat? Alzheimer's disease. The cost annually is over $250 billion. One out of every 5 Medicare, Medicaid dollars goes to Alzheimer's. In a decade, it's going to be 1 out of every $3, and that alone will bankrupt Medicare.
All right, so what we're learning, and the U.S. Bureau of Census has looked at how many people in our society are going to be over the age of 69 by 2020. By 2050, the number is even more staggering of
Yeah.
people who who'll be over the age of 75, right? Because we're living longer. So
That's
I don't,
absolutely right.
Yeah, I mean, it's a system that has to be fixed.
There are more
obviously.
people who are going to be living longer.
They're going to outnumber us.
Higher health care for decades
Real quickly,
more.
Rock Oz, 3 phases because the Senate rules. Because of Senate rules. Matlock 12C, you'll like this. Without term limits, there is nothing but corruption and cronyism in
There you
DC.
go.
Can that be true?
Yeah.
It's true in the permanent state.
No. Well, it's true that we loved having you, Charles.
Great, great.
Yes, Charles, you're
Can't
one of
wait
my
to come back.
favorites.
Thank you very much.
Love having you.